Hello and welcome to the Charlie E. and Minnie P. Hendrix Foundation for Chronic Illness video series, Mental and Emotional Wellness, Coping with Chronic Illness and Caregiver Support. In this first module, we're focusing on a deeply personal yet often overlooked topic, mental health and chronic illness. We'll discuss the emotional impact of diagnosis, recognizing the signs of anxiety and depression, and how to build resilience through change. Disclaimer: this video is for educational and informational purposes only. It does not replace professional medical advice. Always consult with your physician or a licensed mental health provider regarding your individual care. Getting diagnosed with a chronic illness, whether it's lupus, multiple sclerosis, rheumatoid arthritis, or diabetes, can feel like the world is shifting under your feet. It's not just the medical terminology or the treatment plan, it's the emotional aftermath. You may ask, why me? What will my future look like? How will this affect my family, my work, my life? These questions are valid. In fact, a study by the American Psychological Association, or APA, found that more than 50% of people with chronic conditions reported significant emotional distress in the first year after diagnosis. Consider someone newly diagnosed with lupus. Beyond joint pain and fatigue, they may face social isolation, fear of the unknown, and a loss of independence. They may grieve their old self, and that grief is real. According to Psychology Today, grief after diagnosis is a normal psychological response to a life-changing event. You know, it's actually pretty common for patients to internalize their feelings. But when emotional distress goes unaddressed, it can, unfortunately, lead to more serious conditions, including anxiety disorders and clinical depression. According to the National Institute of Mental Health and the Centers for Disease Control and Prevention, having a chronic illness increases the likelihood of depression by about 2 to 3 times compared to the general population. So, what are some signs of anxiety? Well, they may include things like racing thoughts or constant worry, trouble sleeping or staying asleep, shortness of breath, panic attacks, and even avoidance of places or situations that remind someone of their illness. And when it comes to depression, the signs may include feeling persistently sad or hopeless, losing interest in activities that once brought joy, feeling fatigued or having low energy changes in appetite or sleep patterns, difficulty concentrating or making decisions, and sometimes thoughts of self-harm or feeling worthless. If you or someone you love is experiencing any of these symptoms for more than 2 weeks, it's important to seek professional help. Resilience isn't about being unaffected. It's about adapting and thriving despite adversity. Here are 6 practical strategies for building emotional resilience while living with chronic illness. First, develop a routine you can manage. Routine gives structure, especially on days when energy is low. Try to create a schedule that includes rest, movement, meals, and mindfulness. So, another helpful step is to join a support group. According to a 2022 study in health psychology, peer support significantly reduces feelings of isolation and improves mood in people with autoimmune diseases. For example, a woman living with Sjogren's syndrome found hope by connecting with others through an online lupus support group. Next, let's talk about practicing mindfulness or meditation. Mindfulness helps reduce cortisol levels, which can ease both physical pain and emotional stress. Apps like Calm and Headspace offer accessible ways to begin. Honestly, even 10 minutes a day can make a difference. Another important tip is to limit negative inputs. Try to avoid information overload and be mindful of the media you consume, especially when it comes to health fears or worst-case scenarios. Maybe you walked to the mailbox today, or maybe you cooked dinner. It's important to, acknowledge the progress, not the perfection. Therapists can help reframe negative thoughts, introduce coping tools, and validate your emotional journey. These days, many now offer virtual sessions, making access a whole lot easier. If you're a caregiver, your mental wellness matters just as much. Caregiver burnout is real. According to the Family Caregiver Alliance, 40 to 70% of caregivers report symptoms of depression. Caregivers should set boundaries, take regular breaks, seek counseling or respite care, and, join support groups that are really tailored for caregivers. Caregiver check-in, you matter too. Remember, you can't pour from an empty cup. Taking care of your mental health is honestly an act of love, not selfishness. We want you to know you are not alone. Whether you're living with chronic illness or caring for someone who is, the Charlie E. and Minnie P. Hendrix Foundation for Chronic Illness is here to support you. Subscribe to our channel, visit us at our website, follow us on social media for resources, real stories, and support. And stay tuned for Module 2, where we'll dive deeper into caregiver support and emotional burnout. Until next time, be kind to yourself, and know that healing happens in more ways than one.